Welcome to Module 2 on Ethical Issues and Advanced Care Planning in Palliative Care. Your assignment in this module is one QSGA, a written assignment, that will be based on the textbook readings, the information provided on the New York State MOST forms, and the information provided on the New York State Healthcare Proxy links. In writing your QSGA, pull out what you believe are the most critical issues regarding your readings, the MOST, and the healthcare proxy. The list of learning materials in this module is shown here. The module leads with a 4-page sort of teaching sheet from the American Nurses Association that reviews some of the basic ethical issues and some of the basic ethical theories. Read through that first. I recommend printing that out to have it next to you while you're doing your readings from the textbook. Next, read what's in the text, and then go through all the different links in the module. They're on a variety of topics from some different sources. Within each cluster of information, some of the videos are labeled as mandatory and others are labeled as explore at your leisure. Be sure to watch all of the mandatory links. Each one is, only a few minutes long. Then read through all the materials provided about MOST forms and read through all of the materials provided about healthcare proxies. While you're reading, be sure to understand the differences and applications of healthcare proxies and MOST forms. And again, please take notes or keep a diary or do something active while you're going through the materials to enhance your retention of the learning materials. In general, this module will cover ethical issues and how they relate to palliative care. You'll see that the emphasis in this module is really on autonomy, which is key. And to facilitate autonomy, we will discuss advanced care planning tools. These would be in the form of having discussions and documenting patients' wishes. And while you're thinking about these things, also think about different patient populations that you might work with as in your palliative care practice. What ethical issues might look dramatically different, say, for adults versus pediatric care populations? Think about some of the other populations like elders with dementia or individuals who are otherwise cognitively impaired. So try to extrapolate what you learn about the basics of ethical issues for adults into other populations that you might work with. And again, just a little reminder on how to be successful in the course. Read and understand the assignment instructions in this module. It's pretty simple. Have the rubric in front of you when you're working on the assignment. Be sure to turn in your written assignment to both the Blackboard and Turnitin links. And as always, use the Ask a Question discussion area if you have questions. Thank you, and enjoy the module.